Minnesota has seen an uptick in COVID cases recently. Health officials are encouraging people to continue taking precautions, including keeping up with your recommended booster shot. Kate Raddatz spoke with the commissioner of the Minnesota Department of Health about the future of the virus in our state.
We haven't seen you in a while. We went from having daily updates to that it was a couple every days, maybe it was weekly. Is that a sign that are things fine now? Are they better, or is that just, have you been taking a little bit of break from those updates, or where are we at?
It indicates we're in a different phase, certainly, where things have been a little more stable after that big surge that we saw of the first variant of Omicron late in December and through January and into February. So things were pretty intense then, and things have been getting better since. Now, quite recently, more recently in the last few weeks, we have seen cases start to go up again, as there is a new variant of Omicron. It's still Omicron, but a different version of Omicron. So we've seen cases coming back up a bit, but we also feel like we are in a different phase because we've got better tools to manage it now, between vaccines, boosters, and some of the new treatment options. We are thankfully not seeing hospitalizations go up to the same degree they did previously. Hospitalizations are starting to tick up a bit too, but not nearly as fast as cases. So we are definitely in a new part of the pandemic, but it is most certainly not over.
The new cases that came out today recorded, I think it was around 2,500. I'm trying to remember, I think even a month ago or so, it was as low as, I think possibly in the 500s, something like that. Looking at that 7-day average, we're about where we were at in August. And you touched on it a little bit. It sounds like, yes, cases are going up, but you do think that it's different compared to back then. Is that because of the treatments we have?
I think it's because of vaccinations and boosters. We are leading the nation in the percentage of our folks who are eligible for boosters actually having gotten boosters. And we know that one of the things about this virus we just have to keep paying attention to is the virus continues to evolve, and we're learning more and more about how long immunity lasts after a vaccination or after a prior infection. So the value of getting boosters on top of a prior vaccination or on top of a prior infection really is proving to be very, very helpful, particularly in preventing the more severe disease. So it is vaccinations and it is the new treatments that now help people who are at higher risk of severe disease. If they get tested and they get treated promptly, their odds of getting severely ill and ending up in the hospital are vastly improved. So it's really important that people do continue to monitor for symptoms, get tested, and if you're a higher risk person, get in touch with your doctor and get started on treatment quickly, because that's when the drugs are the most effective.
What do you tell people is the best advice at this point in the pandemic, where we don't have the surge that we had in the winter time? Hospitalizations seem to be better, but as you said yourself, the pandemic isn't over. What's the number one piece of advice you tell people to protect themselves?
I think just to continue to pay attention and to think about your own personal risk situation and also the risk situation of people around you. So there are times when it's a very good idea to continue to wear a mask if you're in crowded situations or if you're gathering with people whose status you don't know. It's a good idea to test before you're gathering with large groups of people or people who are more vulnerable. They may be immune compromised, or they may not be able to be vaccinated for one reason or another, or they've got a lot of underlying conditions. So just being mindful that folks are in different positions in terms of their risk. And so we're all making, different calculations based on our own individual circumstances, but remembering always that there are people that we care about and people around us who may be at higher risk than we are. So being mindful of that as we interact with each other as well.
Do you think we could ever go back to mask mandates? Do you see that in the future with cases going back up? Do you see that happening?
Well, I think certainly the CDC has said, and we agree, that when case levels and hospitalizations get to a high enough point to really create a risk for the whole community, wearing masks indoors is a really good idea. Is that going to mean requirements or mandates? That I don't know. I think, but certainly the health advice to take those additional layers of precaution when the circumstances merit it will continue to be what we advise people.
What do you say about where we're at? Would you say we have reached the endemic part of the pandemic? Has it become that?
I wouldn't say so quite yet. And then that may be different, probably will be different from one part of the world to another. But certainly, as long as it's a global pandemic and we're seeing the amount of transmission around the world, that's what creates the opportunity for new variants. And as we've learned, as these new variants come along, that can really change the picture again. So that's part of why I think it's a little premature to say we're definitely at that state where it's just in the background and kind of manageable, which is sort of what endemic typically means. It's still a very fluid situation, and there's still a lot of virus being transmitted, certainly around the world, but again here in the United States and in Minnesota as well.
Last week, the legislature authorized, I think it was $190 million for future COVID response or needs during the pandemic. What would that money be used for?
Well, we're actually really appreciate that the legislature realized that the work is ongoing. We're still working hard to get more people vaccinated, to make sure testing is available, these new treatment options that we spoke about. There's work yet to be done to make sure that everybody in Minnesota is as protected as they can be. And that does require ongoing funding. So that funding was really to allow us to continue to do some of that work and to be planning and preparing for a potential future larger surge like we've seen in the last two falls. That the funding is much appreciated. Quite honestly, if we were in a big surge, we would need more resources than what just has been approved. But we're very grateful to have some additional funding over these next few months to continue to do the work that we need to do.
Do you sense that people think the pandemic is over?
That is a concern, quite honestly, and we're all certainly eager for it to be over and to think of it as something in the past tense. But I think our national leaders have been telling us for a while, and our local health leaders as well. This is something we're going to be living with for a while. But the key is to get to a point where it's manageable, where we can prevent it and we can treat it, and we can keep it from disrupting disrupting our healthcare system, disrupting schools, businesses, and the like. But in order to keep a handle on it, we do have to keep paying attention to it and keep using those tools like vaccination and testing and availing ourselves of treatment. And just know that circumstances may change. We may have periods of time when the cases are at a higher level, and then it's a good idea to use some of those layered mitigation strategies like masking and avoiding close crowds, especially indoors. So those prevention strategies are going to continue to be useful to us, and just kind of getting used to the fact that things are going to, when we're in a period of lower risk, we should be grateful for that and take advantage of that, being mindful that that's not true for everybody. Some people remain at higher risk even when things in general are calmer, but just know that when it's not raining, you don't throw your umbrella away. You keep it handy in case you need it again. So that's sort of the situation that we're in.
Keep watching CBS News Minnesota for continuing coverage.